Hi, I'm Lori from HIS Talk. Welcome and thanks for joining us for today's webinar. It's titled Best Practices for Increasing Patient Collections, and it's brought to you by MedData. Before we get started, I have a few things to make you aware of. Attendee phone lines have been muted to prevent background noise. You can use GoToWebinar's questions box in the console to submit questions to our presenter at any time. The presenter will answer your questions during Q&A at the end. Today's webinar is being recorded, so you will receive links to the recording as well as a PDF version of the PowerPoint presentation. Our presenter today is Jason Bird. Jason is the Director of Client Operations for MedData. With that, I'll turn it over to you, Jason.
Thanks so much for the introduction. I appreciate it, and thank you everybody for taking time to join today. I'm excited to be able to talk with everyone and share some insight into both my experience as well as MedData's experiences in the patient payment sector. As healthcare continues to evolve, the patient responsibility component is seeing some of the most dramatic changes and changes that are some of the most challenging to address. And I think many of us are seeing that already and have been struggling with that perhaps for a couple of years to date. So looking at the agenda for the call today, some of the things I want to talk about may seem obvious, but many people I talk with still are not applying a lot of the methods that we're going to be reviewing and are looking for additional ways that they can start trying to apply some of these concepts to make a difference in their organization. So for the agenda, we'll start off by looking at the current environment, look at where we are with patient responsibility today and the near future outlook. We'll move into some strategies on how you can start increasing patient reimbursement within your organizations. And then we'll look at what are some expected results. So this is obviously some new territory for many people, and trying to come up with some realistic expectations and targets is pretty important to identify whether you're making the progress you need to. And then we'll move into some questions and answers, and as Lori mentioned, you can submit those along the way, and I'll address them when we get to the end. So kind of moving into the current environment, there's no denying that patient responsibility continues to rise, and the Affordable Care Act most recently is really only contributing to this. The patient's now the #3 payer behind Medicare and Medicaid, and patient pay is projected to rise, even as much as 50% by the next decade. Mark Bertolini at Aetna recently suggested that or predicted that percentage. So using our call center is an example, and when you're looking at MedData has a large call center that focuses on patient responsibility, activity, and handling inbound and outbound communication with our clients' patients. And so what we're seeing in talking with a lot of our agents is that people are enrolling into the Affordable Care Act or plans on the exchange. They've lowered their cost. They've now found a plan that reduces their monthly payment, and that is a huge benefit that they see in their eyes until they go in for service. And everyone, and then at that point, they're surprised and frustrated, confused as to why they now owe a large balance for their health care. So everyone needs to be anticipating how they're going to be responding to this, not only knowing how to communicate this information to the patients, but also being a little bit more proactive and anticipating these types of payments that are going to continue to rise. So as you look at this uncompensated care, the reason we need to anticipate and plan our approach is really because of what this means, obviously, to our revenues moving forward. So 5 to 10 years ago, most healthcare organizations could afford to write off patient balances, but this just isn't possible anymore. I think we all know that. So Since the majority of organizations are not equipped to adequately handle this change, again, what I'm seeing is a lot of organizations still haven't been able to adapt to the rising patient responsibility balances. Now is really a critical time to be implementing some of these strategies to drive results. So when we look at the cost of collecting versus not collecting at all, there's really no question that collecting from patients is more expensive. But let's look at it from the perspective of volume and technology. So if you look at all of the billing platforms that are out there today, the NextGens, Epics, McKesson, Cerner, you name it, they really were all designed to handle the insurance payment component of the billing cycle, or the revenue cycle, and the interaction with a handful of payers, certainly not thousands of patient interactions. So this collection process really is requires an entirely new set of tools that most organizations weren't really anticipating when they started purchasing these platforms. So how can you expect to get a good result if you're not using the same tools that are used in other, what I call retail or consumer-oriented industries? So we need a new approach. We need different technology, different processes, different staffing models. So using the right toolbox can help you be more efficient and focus on efforts that will make it not only more beneficial, but certainly make the cost of collecting these patient dollars much more in line with what your results should be. In our experience working with patients over the last decade, most patients have the ability to pay their responsible balance, but many don't because of a few key reasons, and they're listed here. So one, they don't understand them. They don't understand their payment options or whether there's flexibility in how they can pay. And three, frankly, they were never asked to pay. So what we have found and what we have implemented over the last number of years is really applying a proactive education model in order to improve the communication that goes along with this segment of the revenue cycle. And what I mean by this is the patient responsibility piece is a huge culture shift for everyone, especially patients. As we know, healthcare is extremely confusing, so you need to reach out to them, you need to help them understand, you need to ask them for payment, and then results will follow. What we often use the example of, or the analogy of patients having two piles of bills. One pile are the ones that they clearly understand, that they know that they have to pay every month, their utility bill, their cable bill, their heat bill, their mortgage, etc. Those are standards. They have no question that that is what they're responsible for paying. There's perhaps another pile, typically the healthcare bills that they get, where there's all kinds of questions. Did my insurance pay on this? Am I supposed to wait until I hear from somebody? How am I, what is the flexibility in how I can even pay for this right now? Am I supposed to use my HSA? All these questions that sit out there that patients just need clarification on and guidance in order to help facilitate that process. So let's get into some strategies on how you can deal with this new reality and what we have found to be successful. Patient-focused and consumer-friendly approach. It seems obvious, but it's critical. So treat the patient the way they want to be treated, with dignity and respect, and it creates opportunities for dialogue. And the dialogue piece is where we think, or what we've found is to be one of the most essential. You look historically, traditionally healthcare has been used to a quote-unquote collections approach, whereby there is a more forceful or a punitive effort to get payment. We've found that while this certainly can be a component of your process, it doesn't necessarily drive better results. It also does not help with goodwill or referrals if there's some negativity along with that process. So what we want to focus on is, obviously our goal is to provide the most exceptional customer service possible. We want it to be a fabulous experience from beginning to end. And one thing that is important is to create a consistent communication process, or one voice, as we often say, for the entire process. Before they come in, through the time of service, through post-visit and all their financial responsibility piece, create a consistent voice and message and resource for the patient to utilize and help them understand where they stand with their service. So offer flexibility, offer convenience, streamline their experience throughout. And so some of these suggestions are listed here. So same-day scheduling, pre-registration calls, which can really help gather information up front, streamline check-in process, set expectations before they come in, online registration, completing paperwork prior to the visit, again, simplifying their process, as well as insurance verification, so getting the most up-to-date, accurate information. All of these are touch points and opportunities for you to communicate with the patient, help clarify any questions along the way. Patient-focused. Nobody likes surprises, and these tend to lead to bad results. So keep the patient informed on both the clinical and the financial process, and make the entire experience possible. Obviously, the clinical side is a crucial component where you need to continue to provide an understanding of what's going on, but the financial side isn't any less important. We often or frequently see hospitals, as an example, that have offer an exceptional experience for the patient. So they have gourmet food, they've got piano playing in the lobby, they've got valet parking, they've got all of these services that are available to make the experience for the patient when they're in the facility great. But then after they leave, it's just the standard 3 patient statements, and then they're off to collections. So that all the effort that went into this process or experience in the front end was just lost as they moved into the financial responsibility area. Thinking about physician practices for office-based specialties, scripting at the time of service is a critical component to be talking about what are the things that the registration staff needs to be discussing with patients when they come into the office. For non-office based, where there isn't as much interaction with the staff when they're there, we even do some proactive education before the visit to help the patient know what to expect. So a couple concepts to consider there. Consumer-friendly options, creating communication that initiates a response. Again, I referred to the dialogue previously. Whatever you can do to create a response, create communication, an opportunity to discuss with the patient what's happening throughout the process is pretty critical. And consumer-friendly bills, or patient-friendly, HFMA often refers to it, is a really important first step. HFMA in particular has developed some great guidelines for this that show how to make things clear, concise, and correct for the patient. So that is a great resource to look to try and identify ways that you may be able to improve your statementing process. Another thing that we have found to be extremely helpful is just listening to the patients. Over the last decade, we have gathered or captured a lot of the frequently asked questions that come into our call center. And what are the things that are asked again and again that may be clarified as part of the statement? So where do I find my ID number? What is the easiest way to put that so it's the quickest spot to recognize it? Or where's the contact information placed, and how do you make that more visible so that it's easy for the patient to reach out to you and connect? What is their actual responsible amount? How do they know what to pay? Is that clearly represented? So, again, some simple concepts, but pretty critical as to making it as convenient and effective for patient communications. So payments, this is the big goal, right? So if we want patients to pay, we have to make it as convenient, as flexible as possible. So give them plenty of options. Think about your audience as well. We're finding that the younger generation, as an example, is more responsive to self-service tools and used to doing everything online. Many are not even using their checkbooks. They're going online for everything. They're interacting with our call center via chat rather than the phone. So as you think about these different payment options, think about the audience or the demographic that you have within your patient population, and what are going to be the most critical components that you have available. Some other things that are pretty common: point of service kiosks, obviously patient payment portals, we talked about that, IVR or interactive voice response, so some automated call technology that allows the patient to interact with you or resolve patient balances 24 hours a day, 7 days a week. Credit card and debit card acceptance, some flexibility there is obviously a common one. And then another one to think about is auto payment plans, or how do you make it so that they can set up a payment plan that is automatic or auto withdrawn from their checking account or their credit card. Referring more to the portal areas or online activity, as we see more patients moving to these methods, having a really robust and easy to navigate portal is another important factor to consider. Make sure, and surprisingly enough, make sure they know about it. We found that about 35% of patients who have access to a patient portal don't even know that exists, and 31% say their physician never told them about it. And obviously they're going to be interacting with their physician, a great point of communication to relay some of these messages. Some other ways that can be simple just to make sure that they're aware of these, communicated on the statement, inform them of your online options as part of any outbound calls you're making, as part of your hold time recordings, a variety of different methods that you can utilize to emphasize and point patients to that portal tool. Really, what we've found is providing tools that patients need for self-service to do everything online. It not only provides for great service, but it also can reduce your staff time in resolving questions or concerns. So whether it be scheduling appointments, making payments, setting up payment plans, updating their insurance information if that's frequently changing, view, printing, sharing documents, updating contact information. All of these are things that you can help automate or allow them to self-service, making it more convenient for them and reducing time from your team. We already talked about some concepts for the multiple payment options like portals and kiosks, IVR. What's important to remember is that not all patients will be able to pay their balance in full within 30 days. So even though you give them multiple options, if they can't pay using those options, you're really out of luck. So you need to obviously anticipate some flexibility in how they're going to be repaying these balances, especially if it's a larger balance. Payment plans, I think most organizations are willing to offer this. The question is, what are the term limits that you're allowing the patients to make? So we will frequently go out to 36 months with say, minimum balance of $15 to $20 on these as some examples. So really extending those terms based on that balance size to really help those patients make the payments because they are typically wanting to do so. You just have to give them the ability to do it. Other incentives for pay with the discounts for paying early and discount policies for uninsured or underinsured. This is another big one, but we often see organizations trying to give discounts, but relatively small discounts on self-pay, on the self-pay population. And what I'll typically advise them is put a self-pay or a true patient responsibility, no insurance. Put them in line with whatever your insured patients would have. So look at your insurance adjustments, your insurance contractual write-offs, and then what is the patient responsibility that's left after that? And is it really fair for a self-pay patient, or is it really feasible or realistic for a true self-pay patient to pay the full charge amount or a slightly discounted full charge compared to a balance after insurance payment patient? And then finally, some loan programs. Obviously, another great tool that provides some immediate reimbursement with some less expensive options than credit cards. One thing to consider with those that is, obviously it's a benefit for you to get a quick reimbursement, but typically they'll be working directly with that organization to repay that balance over the life of that loan. Let's touch on patient satisfaction a little bit. This is not necessarily tied to patient payments, but patient satisfaction will certainly be tied directly to reimbursement. And as we look at some of the HCAHPS surveys, it's certainly going to impact Medicare reimbursements based on patient satisfaction from the service. But some simple automated surveys, for example, can really help quickly assess a patient's experience and identify issues related to quality of care, and even positively influence some of the results downstream. So if you're used to having a Press Ganey type survey or a larger hospital-related survey, some quick surveys early in the process can identify what those problems are, help you resolve those quickly with the patient, and actually have some positive influence on those later surveys. IVR or online tools also work great for surveys, so as another way to get those out and get a quick response from the patients. If you make the surveys easy to use, they can really be a great way to obtain feedback on other areas besides clinical areas. So even what their health plan experience may be, the billing process certainly could be something you could assess, even post-visit. But very few patients express that they have great communications with their providers. So this is a great way to stay in touch with patients and express an interest in their experience with your organization. The only point I would say is just be careful not to overuse these. We get a pretty strong response rate. Typical surveys are used to around 2 to 3% response rate. We're seeing upwards of 8 to 10%, largely I think because of how and when we're utilizing these. We're very careful of making this a pretty user-friendly tool that's quick and it's limited in its requests. So patients that we're getting these all the time may be less apt to respond to them. Outsourcing, obviously a question that often comes up as people think about how to handle the patient responsibility component. Previously, I mentioned how technology for insurance billing wasn't created with patient billing and communication in mind. As more and more dollars move to patient responsibility, this is a significant process, staffing, and technology change for most healthcare organizations. So remember that this is not usually the function that certain staff are willing to do, are trained to do, or even what they were originally hired to do. So is the team that you have ready and available or currently handling this work the right team to do this with the right technology? So when you consider outsourcing, this is something that could really allow your team to focus on the areas where they frankly should be spending their time, and then use the partner's technology to successfully handle these changes. Make sure your partner mirrors the customer service that you are used to or that you would want. Obviously, they're interacting with your patients, so you want to make sure that their communication is consistent with how you would handle those. But in many cases, you don't have to lose control of how you're handling those accounts. Cost is often a concern, but make sure you're factoring in whatever increase in revenues and additional found insurance that the partner may be identifying. So with the additional technology and the staff that is focused or trained on handling this patient communication, the likelihood is that a partner could do better than what you're doing now. So make sure to ask for projections and what expected revenues and costs may be by utilizing this type of arrangement. The other thing to think about is when you, from the technology standpoint, trying to custom build one of these tools, which offers a lot of the components that frankly may be important to have, could take a long time, if not years, to build and develop internally. So could that be a short-term solution in order to get something larger in place within your organization? Cost savings and benefits. So by applying patient-friendly approaches, and again, I keep coming back to the communication, customer service, patient-friendly, because that's what our philosophy revolves around and where we've seen the most benefit. But MedData has seen a significant improvements. Many patient clients have seen their reimbursement rates increase by over 36% after adopting some of these patient education and satisfaction programs. Patients that understand their bills typically pay their bills. You know, again, I said this earlier. Also, good patient communication uncovers additional insurance information. When you're communicating or proactively reaching out to patients, you will typically find a lot of insurance information. In our case, it's about 21% of the accounts that we handle. We find additional insurance information on that. With Medicare, higher HCAHPS scores result in better reimbursements. Obviously, patient-friendly has an impact there. Found insurance and big revenue improvements there. Oh, you know, obviously, happy patients is what the goal is, and results will follow. With increased productivity, you know, again, focus your staff on what they do best. Handling patient calls effectively takes a pretty certain and specific skill set. We have our patient service reps go through about a 4-week training program, and then there's monthly ongoing training thereafter. How you interact with patients is a very different process, obviously, than how you would handle or speak with to do insurance follow-up. The other thing I mentioned about before, building world-class technology to handle these balances can take years with a lot of costs. So consider a partner that may be a good solution here. Finding additional insurance. Better and more proactive communication results in more found insurance. If you estimate conservatively that you're reimbursed around 35% on average, and what we see is when we find additional insurance information and return that back to our clients, they are on average getting between, say, 31, 32%, all the way up to, say, 45% reimbursement rate. That is a significant amount of revenue, especially as you look at the volume that you're handling. So this is not something to overlook. Further, as a part of identifying the insurance, you can start to zero in on areas of the system or the organization where the improvements are needed in registration. So you can find the insurance sooner, you can accelerate cash flow, and really not find as much downstream, but you got to start with that proactive communication. Happy consumers equals loyal patients. Finally, just in closing, as healthcare moves into more of a retail or consumer-oriented environment, one of the biggest goals, I would say, is loyalty and referrals. Isn't that really the ultimate compliment that we all want, is having a patient refer a friend or family member to our organization? So to recap, I really advise you to consider ways to change the way you're communicating with patients. Make it easier, make it friendlier, make it clear, and you really will be on your way to improving the patient reimbursements and create loyal customers. Patients who are highly satisfied with the organization's billing process are twice as likely to return. And over 80% of patients who are satisfied with their billing experience are likely to recommend your organization to their friends. So thank you again for everyone for your time. I hope this was helpful. And at this point, why don't we open it up to any questions?
Thanks, Jason. Now, as he said, we'd like to open it up to the audience for questions. As a reminder, please use the questions section in the GoToWebinar panel to submit them to Jason. First question, how do payment plans affect accounts that end up going for further collections with an attorney? How do they affect a practice in terms of violating the Consumer Protection Act and being seen as a lending institution?
Well, in our case, we are not charging any interest on those payment plans, and so we're just managing those over a period of time, and so those accounts would not be sent to a collection agency or go on to any type of attorney delinquent account process, as long as that patient is maintaining a current status on that payment plan. And so if there's ever any point at which the patient stops making those payments, then we're pretty proactive in reaching out to them, trying to get them back on track, and make sure that they're clear on what their responsibility is. Ultimately, if the patient isn't able to pay or stops paying, and then that would be a point at which you could follow your delinquent account process. But normal payment plans under what we would recommend wouldn't run into that scenario, if I'm understanding your question correctly, because they would still stay in a current and okay status as long as they continue to make those payments.
Thanks. Eric would like to know, why is it so hard today for payers themselves to send an easy-to-understand bill to patients for their self-pay responsibility?
Well, that's a good question. I think we all would like to know why that is. You know, one of the things that some of the most frequent questions that we get, and this kind of goes back to a lot of the training and education that your staff would need to have in order to manage the patient calls, is really understand what the explanation of benefits is saying, because along with the patient statement, they're seeing an EOB and trying to make sure they can understand that. So the EOB obviously is going to be a reflection on your organization and them trying to understand what they're responsible to pay. So a key piece is going to be helping the patient really be able to walk them through that, help them understand that EOB. Unfortunately, we don't have the power to really change what the payers are doing at this point. We'll continue to try and influence how that information is presented, but ultimately it becomes our responsibility to help the patients really gain clarity on why they owe what they do.
Okay. Brian would like to know, is it okay to email an estimate to a patient? Are there any HIPAA privacy issues?
Well, with anytime you're emailing information, obviously that would typically need to be secure. I would probably recommend doing that even in an estimation type scenario, to be safe than sorry. And as long as the patient is anticipating that that is how it's going to be coming and that they know how to access that information, that's probably the most important. The estimation piece, I think that brings up a really good point and something that we often talk about. When I mentioned before, creating the best communication begins from before they even come in or from at the point of service. So setting expectations is a pretty critical piece. So we don't necessarily, it varies pretty dramatically what effect an estimate can offer, or whether you can actually collect based on that estimate, because most patients are reluctant to pay if they don't know exactly what their responsibility amount is going to be. And the estimators, while they're helpful, aren't totally exact yet. But to your point, and providing an estimate, even if it's on an email basis, is a really great way to set expectations so that patients have a better understanding of what they're going to see after they have their service. So the secure email I would probably recommend. Outside of that, any information you can provide, even at point of service, to just give them a heads up on that projected responsible amount will only be helpful.
Kim would like to know if you recommend using collection agencies, and if so, at what point you would recommend involving them.
Yeah, well, collection agencies, I think I mentioned, still provide a great part of the process. And there's always going to be a certain percentage of the population that responds to that more punitive or harder approach. So we typically will recommend to our clients that they utilize that, but usually not until at least 120 days or after. And when I say 120 days, I mean 120 days from the point at which they identify their patient responsibility balance. So send at least several statements, make a number of different efforts to reach out to that patient throughout that 120 days, and communicate with them in a patient-friendly way. And if at that point you're not able to get an adequate response to either get a payment, set them up on a payment plan, or find additional insurance, then that patient really is truly ready for the delinquent account process, and I would recommend moving towards that.
Can you talk a little bit about what kind of training you would recommend for call center reps?
Sure. I think one of the most important things that we train our representatives on is what we call first call resolution. So what is the scripting that you're going to use based on your organization that will help resolve those patients' questions and provide the best service to them in order to resolve that issue the first time they call. So whatever you do, whatever you need to do whatever you can to make sure that patient doesn't have to call back a second or third or fourth time. You know, that only creates additional effort for you and your team, and it also creates additional effort and frustration on the part of the patient. So that's probably the most critical piece, is that first call resolution, I'll call it, and then on top of that, what is the customer service focus that you can put on top of it to provide an exceptional experience for your patients. And that's really where I would place the most emphasis on training.
Okay, this question is along the same line, having to do with the call center itself. What kind of RCM technology do you recommend?
That's kind of a tough one. You know, when I've talked about that a couple times throughout the presentation with, you know, you look at all the revenue cycle systems that are out there, they were typically not designed for patient communications. So while there are some tools out there for call centers, there really isn't a full solution out of the box or off the shelf that provides a lot of the tools that I was suggesting. So that's a challenge. So one obviously is you can build that, which could be pretty costly. You know, another piece that I think I failed to mention that I think is a really critical component, especially with all the consolidation that's happening in healthcare, with systems acquiring a lot of physician practices, is that there ends up being a lot of multiple platforms that are out there. So all of these patients are getting potentially multiple statements for all these different services within the same system. So finding a technology tool that allows you to consolidate the patient communication experience is another really critical piece. And I haven't seen many, or if any, tools that are out there off the shelf that would provide that. So one, obviously you could use a partner. You could partner with an organization that offers some of these tools. You can build it your own, which could take a while. You could piece together a few of these type of systems, but probably not the most seamless approach. So, you know, I think as the patient responsibility component of the revenue cycle continues to advance, we'll probably see more of these tools become available. Unfortunately, they're not there outside of some partner organizations.
Okay. Sounds like Tiffany's has had some frustrating experiences. She would like to know what you suggest when bills are mailed, letters sent, calls made, and no response. Then the account is sent to collections, and the patient becomes irate and claims they never saw a bill.
Yeah, that that is frustrating, I think, for everybody. And you know, the approach that we take is really to make as much effort as we can to identify where that patient's located. So whether that's, you know, we'll go through a process where we identify change of address, we'll identify contact information through some skip tracing methods. We will proactively outreach to that patient to try and contact them. And I think if you have done all of those things, you have made a really valiant effort to try and reach that patient. If that is still not successful and the patient is upset, I think it's pretty important that you let them know what you have done in order to try and reach them. I think if there's the understanding that, hey, look, we're sorry that this happened. You know, we certainly didn't mean to cause any frustration for you, but we have made a lot of effort to try and reach out to you, but we just unfortunately didn't hear from you. And so I think it would be up to each organization and how they would handle that scenario, and based on whatever your arrangement is with your collection agency on if, in fact, you can take that account back and service it as if it is a current balance. If the patient now is, hey, now I have the ability to pay, but I think again the communication and how you relay that information and what you did to reach out to that patient is important to help them understand all that was involved on your end. Just to kind of add one last piece is, I think treating patients with dignity and respect, and I think the same goes with how you communicate is how patients will respond. So if you continue to treat them with exceptional customer service, even though you had that negative experience where they ended up going to collections, unfortunately, if you're honest and you apologize and provide a continued level of customer service, most patients will have some level of understanding and still remain positive to the organization. That's it.
Okay. You mentioned medical loan programs. Where can a person go to find out more about them, and are there specific things to watch out for?
I think HFMA is a pretty good resource list of a lot of the finance companies that are out there. The things that I would probably look at is how those loan programs interact with whatever your patient payment policy is. There's, from what I've seen, is that a lot of them only offer loans on balances that are going to be much larger in size. So say minimum of $1,000 or $2,000 balance. So, is that going to represent a pretty significant part of your patient population or not? So is that going to really be something that's going to be helpful for your organization? And then is it something that you're willing to do in losing some connection with that patient? I think similar to working with other partners, and if you were to outsource the whole patient responsibility piece, you need to feel comfortable with how they're going to be interacting with that patient throughout the entire repayment of the loan, because they now are handling that loan on your behalf. The patient is most likely going to be working directly with that financing company. So just be comfortable with what that process looks like, how they're going to represent themselves. Is it going to be under your name, or is it as a third party, and that financing company is becomes the name that's on the statements and things like that. So just continuity of communication with the patient and how that is going to be represented, and if that matches and aligns with your current culture and policies.
If you're able to make a fairly accurate estimate for the patient's self-pay responsibility before they leave the office, do you have any leverage to make them pay before they leave?
I think the question, certainly you have some ability, and you're certainly in your right to ask for payment. What we have found is a little bit more successful is collecting some, if you are comfortable with offering or if trying to get some type of payment up front, and you are not 100% certain of what that responsibility amount is going to be, then probably a more realistic approach is to ask for some type of deposit up front. You're putting a portion of your payment because you know that you're going to at least owe a certain percentage of that charge. So you can, as long as you are providing clarity with the patient up front, asking what I would call a reasonable amount of payment from them at the time of service, I think you are more than within your bounds to do that. And I think that the patients, in most cases, will certainly understand that and be receptive to that if it's communicated well.
Great. Well, that was our last question. So with that, we'll conclude our webinar for today. Thank you to everyone for joining us, and thanks to Jason and MedData for an interesting and informative presentation. Attendees, watch your email for links to the recording of today's webinar as well as the PDF version of the PowerPoint presentation. We look forward to seeing you at our next HIS Talk webinar, and I hope you enjoy the rest of your day.
Thanks so much, everybody.